This is going to be muscles of mastication, the tongue, and the neck. So we're starting on page 107 with muscles of mastication. All right, the first one on your list is called the temporalis. So the temporalis is largely located covering the temporal bone, and the origin is going to be these temporal lines on the skull. So you didn't have these to learn for bones, but they do. This muscle does leave a large imprint, a line on the skull. So the temporal lines of the skull. The insertion is going to be the coronoid process of the mandible. So if you remember your mandible, there's two processes that stuck up here. The one that sort of makes your jaw joint is called the mandibular condyle. The coronoid process is actually up here. So if you look at this picture down here, this is our coronoid process. So that's the insertion. And so it's going to draw the coronoid process upwards towards its origin, right, towards the temporal lines. So it's going to elevate or lift up the mandible. So the action is to elevate, and it can also retract because the fibers do go posteriorly. They can retract the mandible a little bit. So let's look at the temporalis. We can see that it's right here, it's deep. So remember last time we talked about how there's two muscles laterally on your head. One is the temporoparietalis, which is superficial, and the temporalis is deep. And remember that the temporoparietalis is the one that just moves the auricle of the ear, so it does not have a function to masticate or to chew. That is the temporalis right here. Okay, the next muscle is our masseter. So our masseter is also a very large prime mover or primary muscle of mastication along with the temporalis. So you can see that the origin is going to be our nice zygomatic arch here, and the angle of a mandible is going to be the primary insertion point. So you can see this is our angle. It says another muscle here, but so it's really going to lift or elevate our mandible as well, and a little bit of protrusion, so a little bit of going outward, a little action there too. The next two muscles we see in the muscles of mastication are over here. So they're called the pterygoid muscles, and one is medial and one's lateral. The medial pterygoid, you can see, is the sort of up and down direction here, and the lateral pterygoid is going to run laterally. So they're going to have actually the same, they work together to sort of grind your mandibles, to grind your teeth, so back and forth kind of action, side to side. They both move the mandible side to side. However, they have different actions in terms of elevating and depressing. So if you look at the internal or the medial pterygoid, it's going to insert onto the ramus, and it is a little intuitive here. So if we're going to pull the insertion or the ramus up towards the sphenoid bone here, it's going to elevate our mandible. The other one that might be a little bit more difficult to picture is our lateral pterygoid, where the insertion is now going to be our mandibular condyle, right? So this is our mandibular condyle. And as you pull it towards its origin, you might imagine that this mandibular condyle goes in, and it's going to drop. So it's like the letter L. If you pull this portion of the letter L in, then the inferior part's going to go down a little bit in the angle. So it's going to, it's going to depress the mandible. So those are our pterygoids. And pterygoids are not visible on our models, so we're going to have to just use a diagram for that one. Let's look at muscles of swallowing and the tongue. So before we leave, let's take a look at our masseter here. All right, and our temporalis visible. Our pterygoids are not visible because they're very deep. All right, so before leaving too, this is just a nice cadaver shot. Here is our nice big masseter. We can see our buccinator deep to that. We can actually see our zygomaticus major, our zygomaticus minor, our levator labii superioris, nasalis, procerus, all the ones we talked about, our nice round orbicularis oculi, frontalis, and this is our platysma. We'll get to that. All right, so muscles of swallowing, again, not on our models because these are very deep. So we have a group of muscles known as pharyngeal constrictors. So these pharyngeal constrictors as a group, we have an upper or superior pharyngeal constrictor, we have some middle pharyngeal constrictors, and inferior. These are all shaped like the letter C, and so when you begin to swallow, these are skeletal muscles that will start to sort of push the food into our esophagus, when it enters our esophagus, it becomes smooth muscle, and the smooth muscle will pick up and squeeze it to our stomachs. But the initial sort of travel down our throats is skeletal muscle by these constrictors. So again, these are not visible on the model. You want to be able to recognize them on a diagram. The term bolus in your action for this muscle group, a bolus is the food that you have chewed up and mixed with saliva. So you would say that you swallow a bolus of food. All right, next one we have something called the glossus group. So the glossus group is all the muscles that are going to move the tongue. So the word glossus means tongue. And you can see that you're only responsible for knowing that they insert onto the tongue in all movements of the tongue. So you can see that there's different individual glossus group muscles. You do not need to know them individually. You just need to know that as a group, they are called the glossus group. All right, the next muscle, if you turn the page to page 108, we have muscles of the neck. So the first muscle of our neck, the most superficial one, is our platysma. And the platysma is a very broad, sort of thin muscle that sort of just covers our entire neck, as you can see in this cadaver shot. We can see also this actress, Jillian Michaels, actually she's a trainer, using her platysma, and that when you tense this platysma muscle or contract it, it really tenses the skin of our neck. And we use this muscle in fear or disgust, so it's pretty obvious when you tense this muscle. So if we look at the origin, we can see the platysma in this picture here. It's been reflected and cut away, but the origin is going to be on the thorax. So it's going to come from your chest, the fascia of the pectoralis major and the deltoid. So it's really wide. It comes from a little bit of your shoulder all the way around your chest. And the insertion point is going to go up. It's going to insert onto your mandible and then some of the skin of your cheek. So when you tense your neck, it does sort of spread and tenses the skin of your neck, but it also has a role in depressing your mandible. So I heard somebody call this the eek muscle. So if you see something scary and you say eek, that's the muscle that kind of depresses your mandible a little bit and tenses your neck. Next muscle on the list is called Sternocleidomastoid. This is a great muscle. It has two heads, and the name of the muscle, Sternocleidomastoid, tells you exactly where it originates and inserts to. So let's start with the origin. The sternum, so that's the sterno. So this portion of the muscle is going to arise from your sternum. And then the cleido refers to the clavicle. So this other section here is going to originate on the clavicle. So this one muscle is split. These are referred to as the heads of the muscle. So this is going to be our sternal head, and this is going to be our clavicular head. And then the two heads will come together, converge, and then insert onto the mastoid process of our temporal bone right behind our ear. So sternocleidomastoid refers to the origins, the sternum, the clavicle, and the mastoid process as the insertion. So what the action is kind of interesting. We can look at these two actresses here. You can see the sternocleidomastoid really well on Angelina Jolie here. So this is going to be her sternal head, right? And you can see this is the clavicular head, and then you can see the muscle kind of coming together around here, disappearing behind her ear. Also, Jessica Alba, right? So we have a really nice prominent sternal head of the sternocleidomastoid. So when this muscle contracts, we can read the words here bilaterally. So if you contract both sides together, we're going to actually bow our head down. So if we look down, it's going to do anterior neck flexion. That's what that is. But one side, so these actresses are just contracting one side. Unilaterally, we're going to have ipsilateral neck flexion and contralateral head rotation. So that means that the same side, ipsilateral, it's going to be flexed. And then we're going to have contralateral neck rotation. So we're going to have our neck and head rotate to the opposite side that the muscle is using. So basically she's looking in this direction here, but she's contracting this muscle. So we're going to have this muscle contract, but she's looking the opposite direction. So that's our contralateral head and neck rotation. So realize that this muscle is underneath the platysma. So the platysma is so thin that the deeper muscle here, the sternocleidomastoid, can show through rather easily. All right, so that's our sternocleidomastoid. So here is the diagram picture of that again. Next muscle is our Splenius capitis. All right, so this is our Splenius capitis. This is the posterior of our neck. So let's look at the origin, the ligamentum nuchae and the spinous processes of the upper thoracic vertebrae. So the ligamentum nuchae, also known as the nuchal ligament, is going to be a very strong ligament, right? So it's connective tissue that's going to run down from our skull all the way down the spinous processes of our cervical vertebrae. That's the nuchal ligament. And then this muscle arises from here, but it also goes down a little bit further and arises from our upper thoracic vertebrae. So where this goes, the capitis refers to the head. So the insertion is going to be our occipital bone and the masseter process of our skull here, of our temporal bone. Bilaterally, that means together, right? We have two of these Splenius capitis muscles, one on this side, one that's not shown on the other side. It's going to be neck extension, so that means you're going to look up and back, and then we're going to unilaterally, if you're only contracting one side, ipsilateral or the same side neck flexion and rotation. So we contract this muscle here, we're going to have this, your head is going to come down and flex towards that side. All right. Now let's look at our scalenes. So this is a picture of, before we leave to the scalenes, this is our capitis group muscles, our Splenius capitis. So this is a nice picture of what your models look like, and you can see this muscle here on the deeper side of your muscle models. Now I want you guys to notice that the other side, there's a trapezius muscle. This is your most superficial muscle of the back. So trapezius is going to cover up your Splenius capitis. All right, so let's get your scalenes here. Your scalenes, you have three of them. There's an anterior scalene, there's a middle scalene, and then there's a posterior scalene. You can see that all the scalenes are originate on the cervical vertebrae here, and they are going to insert onto the first and second rib. So muscles that insert onto the ribs here, they can elevate the ribs. So if they're going to originate on your vertebral column, the insertion moves towards the origin, so they're going to lift up your ribs. So these scalenes actually help you breathe or inhale, right, inspire, by lifting your rib cage. If you use them unilaterally, so one side at the time, you can imagine that they would flex your neck laterally and help to rotate your neck. All right, so our muscles of the scalenes are here. So we have our anterior scalene, our middle scalene, and our posterior scalene visible on our muscle models. All right, so we're going to end here, and we'll move on to suprahyoid muscles, infrahyoid muscles, and muscles of the eye in the next video.